All right, so this is the Understand SSRIs Better series, and this particular video will be on the differences between the SSRIs. And I wanted to have a focus on how the pharmacokinetic and the pharmacodynamic properties can influence your clinical understanding of the SSRIs. But the series in general will be going into side effects and drug-drug interactions and mechanism of action. But to start, I'll just list out the SSRIs. So this video will be going over Citalopram, which is Celexa, Escitalopram, which is Lexapro, fluoxetine, which is Prozac, fluvoxamine, which is Luvox, paroxetine, which is Paxil, and Sertraline, which is Zoloft. And the common denominator between all these drugs is that they block the receptor SERT, and that's how they got the name the SSRI, although in this video we'll learn that the selectivity part of SSRI is not entirely true. All right, so let's get into it. So the first drug I want to go over is Sertraline, which is the brand name Zoloft. And for each of these drugs, I'm going to go into the other receptors that they hit, the FDA approval, and the off-label use for these drugs. And the thing I really want to focus on is how you could use the other receptors that the drugs hit to kind of remember the differences that exist between these drugs. So the other receptors that Zoloft hits are DAT and sigma-1. It's FDA approved for depression, OCD in kids over 6, panic disorder, PTSD, PMDD, social anxiety, and it's used off-label for generalized anxiety disorder and other anxiety disorders. So Zoloft blocks DAT, and DAT is the dopamine active transporter, which is responsible for the reuptake of dopamine. So if you block that, you're going to have an increase in dopamine. And it's unclear if Zoloft has enough DAT blockade for clinical relevance, but it's still really useful to remember the unique clinical properties of Zoloft, given that what we know about what an increase of dopamine would cause. So Zoloft is mildly activating, so it works best with patients with atypical depression. And just a quick reminder, atypical depression is depression that has weight gain, hypersomnia, interpersonal rejection sensitivity, and mood reactivity. So Zoloft is the SSRI that's known to work best for patients with hypersomnia, low energy, and mood reactivity. The downside of that is it can cause some overactivation in patients with panic disease. Zoloft is also an antagonist at sigma-1. We don't really exactly know what sigma is involved with. It's called the sigma enigma. So it's unclear, but it might help with the anxiolytic effects and psychotic depression, where Zoloft seems to have an advantage. And I can't help but notice that all the SSRIs that are particularly good for OCD also block sigma-1. In terms of side effects, Zoloft is particularly known for diarrhea, or just basically GI effects, and I remember this by remembering it being called Sertraline. All things considered, Lexapro and Zoloft are probably the two best antidepressants in terms of SSRIs, especially Zoloft for anxiety, and that's because they have the best balance of benefits, side effects, and costs. Zoloft, if you use it less than 150 milligrams, it has significantly less CYP interactions than if you use it at above. Zoloft also has the best safety record in cardiovascular disease, and it's proven safe for depressed patients with recent MI. So if I had to summarize Zoloft in one line, I'd say that it's an SSRI that works well with atypical depression, given its DAT blockade. It's got an excellent safety profile, minimal interactions at doses less than 150, and the one downside is that it can cause the side effect of diarrhea. Now, the next antidepressant I'm going to talk about is Escitalopram, which is Lexapro. And the other receptors it hits is basically none. It's the purest SSRI, so it basically just hits SERT. It's FDA approved for depression in children over 12 and for generalized anxiety disorder. And it's used off-label for OCD, social anxiety, panic disorder, and PMDD. So Escitalopram gets its name from being the S enantiomer of citalopram. And just as a quick review, enantiomers are molecules that are mirror images of one another, very similar to your left hand and right hand. And the RS is the naming convention, and left is the word sinister in Latin, so that's where it gets the S, and R is rectus, or right, as in morally right. As you can see probably on the drawing board, I'm left-handed, so obviously this naming convention is very upsetting to me. So when drugs exist as enantiomers, usually only one of the enantiomers is responsible for the physiological effects, and the other is less active, or it's inactive, or it produces adverse effects. So that's kind of the situation for citalopram, where the S enantiomer is the one that has the effects that we want. So other drugs that have this enantiomer, there's a quick review, Azopiclone, which is Lunesta, there's also a drug called Zopiclone, so that's the S enantiomer. S-ketamine, which is the S for ketamine, amphetamine and dextroamphetamine, which is the counterclockwise version of amphetamine. Methylphenidate and dexmethylphenidate, which is Focalin versus Ritalin, and modafinil, which is Provigil versus armodafinil. So that's just Nuvigil. So escitalopram is modestly superior to citalopram in efficacy and tolerability, and I'll go into the next slide. So Lexapro is known for being the most selective SSRI, so it's basically just purely hitting SERT. which helps me remember that it's the best tolerated. It has the fewest side effects, probably has the least amount of insomnia. It's got a linear and dose proportional pharmacokinetics, and probably has the fastest onset of action for any antidepressant. So all things considered, I think that Lexapro and Zoloft are probably the first line antidepressants. Other important things for Lexapro is that it's improved in kids 12 and older. So only Lexapro and Prozac are approved for children, and for Prozac, it's approved for kids 8 and older. And also it's known to mildly raise QTC. Generally, we prefer the prams, which is citalopram and escitalopram, for the medically ill and the elderly because it has the least amount of drug interactions, but it also has the worst record in terms of the QTC interval. So, with all these drugs, there's pros and cons. One other thing about Lexapro is that I have this theory that Lexapro is what flipped Kanye into mania. From his 2016 album, The Life of Pablo, you can hear this line. You ain't never seen nothing crazy than this when he offers Lexapro. And then in 2018, he drops his Yay album, which the cover says, "I hate being bipolar, it's awesome." So that's why I have this theory. So if I had to use a one-liner for Lexapro, I'd say it's the purest SSRI. It's got the fewest side effects, the least interactions. It's approved in kids 12 and older, and the downside is that it has mild QTC increase. So now the next SSRI I'm going on to is Citalopram or Celexa. The other receptor it hits is histamine. It's FDA approved for depression, and it's used off-label for OCD, social anxiety, GAD, panic disorder, and PMDD. So as I was saying before, citalopram is the racemic mixture of escitalopram and R-citalopram. So the R enantiomer is kind of the problematic enantiomer in this mix. So that's why I kind of think of it as similar to escitalopram with just a few additional problems. So the additional problems is that it causes worse QTC prolongation. The FDA said you can't exceed 40 milligrams per day of citalopram because it's not effective and it's just a higher risk. And they say don't exceed 20 milligrams a day for patients at higher risk. So those patients are patients older than 60, patients taking a 2C19 inhibitor. An example of that is cimetidine, and people who are poor CYP2C19 metabolizers. And the other problematic thing that the R enantiomer causes is that it has mild antihistaminergic properties. The R enantiomer also can interfere with the S enantiomer, so that kind of means that it alters the dose effect curve. So as you get higher, it's not, because the R enantiomer interacts with the S enantiomer, it makes it so it kind of has a leveling off of efficacy. The other thing that citalopram is known for, it has some favorable findings in the elderly. So if I had to give a one-liner, Celexa is basically escitalopram plus the problematic enantiomer that's got a little bit of antihistamine and causes more QTC problems.